I'm Paula Schuerer. I am a veterinarian in Franklin, Tennessee, which is a suburb of Nashville, Tennessee. Left hand was done March of 24. Right hand was done June of 24. Dealt with it for quite a while before I really realized that there was something going on. It was the CMC joint, so significant osteoarthritis. As a small animal veterinarian, I do a lot of hands-on type of work, especially a lot of dentistry. So holding a dental drill, it looks, for lack of better words, like a screwdriver, and having to grip and twist and hold and turn is really starting to become very uncomfortable to the point of just downright pain. I also do a lot of extracurricular type things, so I'm very much into woodworking, welding, things of that nature, creative type stuff, and just handling things. Couldn't grip them. I was actually holding an oxygen bottle to put in my truck, and I just could not hold it, and ended up denting the side of my truck because I just couldn't hold it. So those are the kind of things that I found were escalating. Squeezing a lemon in my iced tea was getting to the point I couldn't do it. I just could not. Any kind of squeezing, ziplocks, zipping a ziplock, undoing a ziplock, any kind of pinching maneuvers were excruciatingly painful. Initially, a hand specialist here in town who came very highly recommended offered intra-articular injections of long-acting steroids. The first injection was marvelous, gave me great relief for about 6 months, and second injection, not near as long. And if I recall, I think I went in for a third one right before my wedding day, and I got nothing. I was really hoping that while on our honeymoon and everything, I would have relief, but I mean, my husband ended up having to carry everything and really assist me with any kind of gripping type actions. Shortly after being married and him seeing how almost debilitating it was becoming, we were discussing because I kept saying, in today's modern time, why do we not either have an implant? In veterinary medicine, heck, they're doing 3D imaging or 3D printing with 3D MRIs to make customized parts for animals. And I'm like, why can't we do that for humans? And so we literally started doing like a Google internet type research and stumbled upon a couple different products, one of which was being the BioPro. And that's how I discovered it. The biggest expectation I had was, is this the end of my career? Or can I get to a point where I can comfortably continue what I love? So could I come out functioning at a level that I could continue to practice veterinary medicine for another 15 or so years? The surgeon indicated that I had a high probability of doing that, and so that's where I went. I was able probably to functionally tie a shoe within 3 to 4 days. I could do most things fairly quickly. Obviously, anything pinching or gripping or unscrewing a bottle cap, no. But doing stuff where I did not need assistance. I could bathe myself. I could, I could brush my teeth as long as I had an electric toothbrush, things of that nature. So pretty quick in that manner. I was in physical therapy by week 2, pinching putty, rolling things, picking things up. So it was pretty quick on low level usage, but by 12 weeks out, I was pretty good, to the point that that's why I had this one done in March and this one done in June. I wanted them to have overlap, just so I could get on and get to the finish line as fast as possible. Strongly consider this. I did end up having to go out of state to have it performed by a surgeon in Florida, and I had to factor all of that in. But as a veterinarian, I need my hands to do what I do. I do a lot of surgery, do a lot of dental surgery, all different kinds of hands-on type of procedures, obviously. And having discussed this with several of my clients that were oftentimes older than me that had sustained the same type of problem and had the tried and true classic ligament and tendon interposition type of treatment, many of them only had one hand done because they said they'd never get the other one done. It was just such a rough recovery. So that was a big put the brakes on, let's step back, let's take another look. And that's again why I determined that for me, having something that got me back in the game as fast as possible, thus went with BioPro. Yeah, I think Dr. Badia was very instrumental in my decision making. He came across as very confident in his abilities. I actually asked them to give me a recommendation to someone else that had had the procedure performed, and they ended up putting me in touch with another veterinarian out of Massachusetts that had it. So I contacted her. We had a lengthy discussion. She loved her outcome, and that was very instrumental in me choosing again to go with Dr. Badia.